We're more famous for helping people get well, but increasingly important is the work we're doing to help people stay well in the first place through prevention services, through screening services that help identify underlying health problems that people may not even know about. And if we get on top of those problems early, we can treat them and avoid the serious complications that can unfold from them.
Population health, when you really look at it at its basic tenet, really is about keeping people out of the hospital. And it really is about coordinating care among different providers. And it really is about providing care in the communities. Brookline really jumped off the map for us as an area that really was high need in terms of community service. One of their chief challenges is lack of transportation and therefore lack of access to health care. We really looked at what can we do to bring services to the community, because in many cases and in many instances, the residents of that area really just don't have the ability to travel for services, say for example, on this campus.
The population that we work with is very underserved, and there aren't very many resources for our families. One of our clients who is sick right now, and he's a young boy, and he needs to go to the clinic that's in Lawrenceville several times a week. He needs to take 3 buses to get there. So he cannot get there all the times that he needs to be there. And the person who's taking care of him works every day. So the boy is missing school, the caregiver's missing work in order to get the health treatment that this boy needs to survive. Now we're trying to get volunteers to pick him up and take him to his appointments, because this boy can die.
People who need healthcare services and don't necessarily have the means to get it are always a vulnerable population. So to the extent that they feel secure, they feel safe, they feel that their church or their synagogue or whatever the venue for their faith, they find that getting services in conjunction with that entity really is a very secure experience for them.
The fact that it's faith-based means that these people trust their church, and it's an organization where they already go to, they already have an established relationship with them. They're kind of a safe space for these people. They already know that there's someone who they could go to in times when they need help.
Community 341 is a new church development to meet the needs of our neighbors. The community part means that we're in the community. We're in the community of Brookline and the South Hills of Pittsburgh. Ministry is about meeting their basic needs, from everything from feeding them spiritually to physically. We have a variety of ministries that are food-based, whether it's a free community dinner or partnering with a local Christian food pantry. So we bring the resources to the community members who often have trouble accessing basic need resources in the city. We also have a lot of people who are in need of mental health services or need support groups for drug addiction or alcohol addiction. We want to encircle them, surround them, join them at table to say, we're your family, we're your resources, how can we help? The health fair is a way to let the community know what resources are available in the community, also through St. Clair, but also to provide some health screenings.
These partnerships between healthcare providers and these community organizations are the fastest, most effective way to spread the word about healthy living and where you can go for access to such things as free vision screenings, diabetes screenings, other ways to make sure you're living to your maximum potential.
In attendance is our ear, nose, and throat surgeon. He is screening for head and neck cancer. We also have a number of nurses who are performing a variety of clinical services. They are doing education in conjunction with stroke and blood pressure screenings. They're also doing bone density testing, as well as drawing some labs in order to be able to assess cholesterol and glucose. Here today is our dietitian, and what they will be doing is talking to moms about how to take food pantry staples and actually make a really healthy meal out of that for their family.
We've also got stuff for kids and for families, where kids are actually playing hopscotch and doing yoga and talking about how they be well today and having some fun with that. And just getting people active and out in the community.
I think I just finished up with a mouth, so they took care of that, and They said everything was great so far. And then I had some blood taken. I didn't like that part, but it was done. It was needed to be done, and I'm sure that once the doctors get a hold of me, they'll do a whole lot more.
So it's just really about what resources are right here in your own neighborhood that you may not be aware of, but also bringing different screenings and services to our neighbors because they may have a need they don't know and they get it here, and that might be a segue to connect them to the hospital.
So what if there wasn't something like this for you to attend in your community, something that's kind of stress-free like that? Like, how would you feel, and what would you do otherwise?
I would skip it and just wait until, like, I had a doctor's appointment at my PCP or whatever for my yearly checkup.
St. Clair has a wonderful transportation service that's free that I don't know many people know about. And so they will also be here and have a van that will show people how to set up services to get to the hospital.
And the doctor that did my oral screening, I would have never known him otherwise, and now he's going to be on my list of people that I would prefer to go to check me out because he doesn't give me that feeling of ugh.
The hospital environment can be very intimidating. People are fearful, they worry about getting sick, coming to a hospital. Hospitals can also be very expensive.
I went to Mexico a few years ago and I got sick. And I walked down the street to the corner, and on the corner was the doctor's office. By the time I left there, I paid $8 for the doctor visit and the medication. That's how affordable it is there. My husband got sick one time, and my mother-in-law was like, oh, no, he doesn't need to go to the doctor here. And she got like an egg and some herbs and mixed them all up and did one of these numbers and sent him on his merry little way. That's what they're used to, and then they come here, they get sick, and they're in this big hospital, and they have no idea as to what's going on. Right? It's very intimidating.
If programs like this were not available, I think that these people would have a very hard time accessing healthcare, or they would wait until it became a health crisis. And what we are trying to do is pretty proactive, and we are trying to make them aware of health situations that may be happening with them before it becomes a health crisis and they have to come to the emergency department. We're trying to get them to follow up on the care in advance so that it doesn't become a health emergency and something that is potentially life-threatening.
We need public funding, we need help. Churches are declining. Many of these resources and programs that met the needs of people in our neighborhoods, people in poverty, were things that started out of churches. We do this all the time. We naturally feed people, meet their needs when we can, but our churches are unable to support them. Pew Research came out with another study showing that mainline churches are in the decline and more people are claiming to not be religious, not go to church. With public funding being cut, there are more and more people flooding churches and nonprofits seeking needs and seeking resources. And they're coming to these organizations that we don't have the funding ourselves to do it. We operate off of what comes in our offering plates. So when our church's attendance is declining, that limits what we're able to provide to the community.
It's not like government has the ability to step in and fill the breach and to provide the free screenings, the educational programs, the prevention services, all the things that our members are doing today to help people achieve a healthy lifestyle.